Hello and welcome everyone to today's webinar, a CEO's Guide to Reopening Your Business in the COVID-19 Era, where we're going to review the top 6 steps for small business leaders. So this isn't just for CEOs. It could be for a CEO, somebody who wants to be, or really just anybody who's responsible for employees in an office, in making sure that the return to work is safe and that the business not only can just survive this, a once in a 100-year event, but also that we can come out of this thing and thrive. So the format for today's webinar, we just recently published an ebook of the same title. So would strongly encourage you to digest that information. It's a 12-page ebook. There's some thumbnails. Obviously can't read it from the small view, but want to orient you that what we're going to do is we're not going to walk through page by page and read to you, but we are going to tackle and kind of unpack the big topics. So for the 6 elements of what you need to do to prepare to open your business. It's when can you reopen, and all the nuance around that. It's not necessarily always as simple as just when the governor says or when the mayor says. How to identify who comes back and when? How do you think about the ordering of that? How to maintain a healthy and safe workplace? How do you think about hiring, onboarding, and specifically re-entering employees back into the workplace? How do you deal with employees who refuse to return? Maybe they just don't feel safe, they don't feel comfortable. And then when they do come back, how do you handle the time off and leave requests? And then ultimately, planning for financial growth and uncertainty. We've done a lot of webinars on EIDL loans, and PPP loans, and PPP forgiveness. We're not going to go deep into that, but there are some other things you can do around tax deferrals and credits as we think specifically in context to COVID and returning to work, things that you can do beyond just a PPP loan. And I don't want to minimize that, that's a huge thing, but other things you can do to help protect your financial security. So with that, let me introduce the panel. I'm Mike Fennoy, I'm the head of marketing here. And of the 4 of us here, Sheryl is the VP of HR for Assure. Mark is a senior HR manager. He's SHRM's CP certified. He's also internationally certified as a professional in HR. Stuart, his current title, I guess, is project manager and works in training, but spent a couple decades in this industry. As I was kind of counting up and doing the math, the 4 of us combined for somewhere around 72, 73 years of experience in the human capital management space between payroll and HR roles. So hopefully we're going to bring some real life stories, not just read to you, what the Department of Labor says for guidance on implementing the Families First Coronavirus Response Act, right? We're going to try to put some color around this ebook and bring real life stories, maybe some best practices, some examples, and kind of unpack this material that we would also hope that you download and use as you either begin to reopen, maybe you already have and can apply some best practices, or you're an office or a business still planning to do so. So with that, let's go ahead and jump into the material. As we're going through, we're going to have the questions and these 6 topics on the screen. In the GoToWebinar user interface, there's an ability to add questions. Whatever time we have left at the end, we are going to tackle questions. I'll do my best to moderate those and then present them to the panel. But you don't have to wait until the end to go ahead and type it in. Go ahead and log it, and we'll do our best to get to them. So with that, let's talk about the 6 steps to reopening. So step number 1. Now this one sounds, I think, a lot more obvious than it actually is, right? So I don't know who wants to tackle this one. Maybe Mark, or if this is for you, right up your alley. When can businesses reopen? But more specifically, what are some of the nuances around? It's not just simply when my governor or mayor says so.
So, Mike, thank you. Great introduction there. So when can a business reopen? Mike's already alluded to it. It could be by decree from a governor, from a mayor, it depends on the industry as well. For instance, a lot of states are now in various phases of reopening, whereas manufacturing can reopen fully. However, a restaurant cannot. Restaurants have to and retail is the same way. You can only open up 25% of your floor space. You can open up 50% of your floor space. You have to have all these guidelines. So when can you reopen? It will depend on where you're at. your industry, and taking a look at what you have available to you. So what do I mean by that? What are you going to do for personal protective equipment? Are you going to require masks? Are you required to have masks? For instance, some states say, yes, you must have all employees wear masks when they're in the workplace. Other states, not so much. Sometimes they say, okay, if you've only got one person way off in the corner by themselves, they don't have to wear it. But if they interact with others, yes, they have to wear masks. So there's guidelines that can be very confusing. What do I do in Missouri versus New York versus California versus Washington? What can I do there? It's really going to depend on all those factors. For instance, we had a company that said, okay, we're reopening, we're requiring everybody to be on staff. Oh, I'm in a state that doesn't allow interstate travel yet. What do we do there? Okay, gee, Mr. and Ms. Employer, what do you think we should do? How about let's work with that employee? You've been accommodating telework till now. Is that an option? So think about your option. Can we continue teleworking? Is there a way to online Zoom meetings, Ring Central, some of these other options that are out there, GoToWebinars like we're doing today? Can we do those meetings that way? Do they have access? Do they have the technology access to access our internal drives, our resources, customer, all that stuff? That takes planning. It seems like a daunting task. It also may seem like, well, this is pretty common sense. Well, there's a lot of steps to plan for in that. So it goes back to, what can I do? How do I want to do it? That's another option there, is that we have to think about, is how am I going to do this? Everybody comes back at once. Everybody comes back staggered. There's a lot of things there to think about.
Thanks, Mark. Hey, so something I think about, Sheryl. So like real world, right? So you've led this function for us at Assure. So we look and feel like some businesses in some ways, others not, right? So in one way, we're an essential business. We never shut down. You can't stop delivering people's paychecks. So we're an essential company. At the same time, big groups of people, maybe in a job family in sales, maybe a job family in software development that easily could work from home. How did you approach this on when to reopen? Because it wasn't as simple, as a national company, it wasn't as simple as when the local mayor said you could, right?
So I think in the beginning of COVID altogether, anytime something new came out, I jumped on it and I worked on it, and I found over time that things change constantly. So, when we started thinking about coming back, I immediately went out and really the resources that are out there that are available, I've been tapping into those as much as I can, because why recreate the wheel? We've already got so much going on. So luckily I had, colleagues and other HR folks sending me stuff they were doing, and we're talking back and forth. But really, in the beginning, I sat down and I came up with this, really extensive plan. And then, okay, we think we're going to open now, and then it gets moved, and then it gets moved. So really what I've learned in this entire process is, have a plan, but I'm really not going to have a solid plan until I have a solid update from the local and state authorities telling me when we can actually go back. And then once that happens, then I'll communicate to employees and I'll really kind of put that plan into place. I think I've done several employee surveys. I mean, those are really, for me, they've been so helpful, because we really have to be accommodating during this time, because even if somebody's not high risk, they may have their own personal reasons for not wanting to come back to the office. So I just think that we've already been so accommodating up until now. I think this entire year it's going to be very important for us to continue doing that, and really kind of getting the feel for what our employees are comfortable with and what they're not. And so employee surveys have been my best friend, and then of course, like I said, online resources or other folks in my in the HR area have really helped me kind of get through some of this. So
Sure. I'm gonna go deeper on that. So I appreciate the honesty. It's like everything was always changing and continues to change, right? It's like, what's the old saying? No great plan ever survives the first shots fired, right? So you got to have a plan, but ready to change your plan. How did you think about, so on one hand, we're like a national company, we're an essential company. On the other hand, we're not a huge company, right? Around 400 employees. Not possible to know all the laws and make policy decisions around every local jurisdiction from every health department. How did that kind of weigh into your decision making and developing a plan at Assure?
So I had my core plan, but I've really been relying on those local leaders, our director of operations. Some sites have HR folks. I've really been relying heavily on the local leaders to kind of pass along anything that I may have missed, because I'm one person and I have a very small department. I can't tackle this entire company by myself. And so by relying on those local leaders who may have a little bit more time to focus on their particular area and, sending that information over to me, that's really how I've approached it.
Yeah, that's awesome. Hey, Stuart, so as you're training and working with site leaders and customer support teams who get these types of questions from customers every day, what are you hearing from the front lines, and how are you informing around this type of guidance?
Sure. Thanks, Mike. So I'm kind of getting two streams of thought. Yes, I am training internal folks, but I also still train external clients. So when I'm speaking to clients, my first question is, how are you doing? How's your business? And then two, how does that look from where you sit? How are you managing this change? And I think to follow up on Sheryls' point, what I'm hearing from decision makers who I work with for training purposes, they have that one person or that group of people who are actually the clearinghouses for the information. I think that's really important to have those folks who are your dedicated people, whether it's a full-on HR resource, or maybe someone who's tasked for that, or maybe just someone who's coordinating the return to work. For questions being posed to our payroll support teams, they're kind of getting the same things. They're curious to know what other companies are doing, especially within their state and locality. So those questions are more along the lines of, what are you hearing? What are other folks doing? I think the overall theme with all we're seeing, again, going back to Sheryls' point, is have a plan, but also be flexible. Because right now, depending on where you're working and living, it's not a matter of what you can do, given the rules and restrictions, it's what you should do. For example, in my home state, we're in what's called phase 2 of return to work, but that's kind of stalled a little bit because in the past week, we've had a spike in new cases reported. So what does that mean for the long-term return to work? Well, it means whatever plans you have, you need to learn to be flexible, rely upon your HR resources to parse the information and provide the information to you if you are a decision maker.
Hey, I want to put this back to all three of you, because Stuart, you just talked about having, I like your phrasing, having people who kind of act as a clearinghouse for the information. Sheryl talked about, hey, we're a small department in HR. I'm only one person. I got to rely on site leaders who live in those localities. One of the things that I had in my notes to talk about it in step number 3 about maintaining health and safety in the workplace was this concept of a COVID coordinator. So, if I'm a 5-person company and I'm the owner, entrepreneur, CEO, president, and chief dishwasher, I probably am that coordinator. But talk to me about what a person who could be the COVID coordinator, or different people that what is it that you rely? And I'll start with you, maybe Sheryl. What is it you would rely on? What kind of information are you relying on them to filter and act as that clearinghouse for you?
So for me, and I'm sure many organizations are dealing with this, I mean, normally it would have been my office manager / HR assistant, right? I would have had her do it, but unfortunately she was furloughed, and so I automatically became that person. I think locally, once we started having our return to work plan, it was a good idea to kind of have like that on-site person. You really have to have somebody on site that's, hey, just do they look like they have a fever? Are they taking temperatures? Whatever rules that you have set forth within that location, are they wearing masks? Whatever it is, you really need kind of at least one person on site at all times to be managing that, to make sure that folks are following policies and that we're, keeping the workplace safe for our employees.
Very
And
good.
it could be anybody really, it could just anyone that's willing to take on that role.
Mark or Stuart, any guidance for what people should be thinking about for, I mean, even if you've got the doors open already, this thing is not over, right? So what would be your guidance around is creating a position of assigning someone the job of being the COVID coordinator, and what should they be on the lookout for? What should some of their tasks be?
Right. Sheryl touches on a great point. Is it can be anyone. However, you're going to have to train this person as to a number of things. One, ADA considerations, confidentiality, consistency, things to look for, high temperature, coughs, congestion, what are the symptoms? So, and consistency in applying all these things. Obviously, you don't want somebody at the front desk going, oh yeah, Sheryl came in, and use Sheryl as an example here. Sheryl came in and yeah, she had a fever, so we just like, well, okay, fine. And then that gets spread to everybody in the group. No, there's really, you have to be careful about how you do this. So you do want to choose someone who you know is reliable, responsible, who can keep confidential information. Could that be your office manager? Sure. Could it be a production manager if you're in a warehouse? Yes. They have to adhere to those things. So you have to choose that person carefully. You have to provide some training. You have to go through the checklist. The CDC, as an example, has some really great guidelines on what to look for. Are you going to do surveys? Are you going to email that out to employees before they even show up? Are they going to fill out a questionnaire? All this stuff. For instance, if you go to a hospital, you're going to have two folks sitting there. Here, are you experiencing any of these symptoms? Well, they're going to take your temperature. They're going to give you a sticker. They're going to ask you where you're going. I'm going to go to whatever. They're going to stick that on you, put this on it so it's displayed so that people who work there, who wander around, know that you've been through the checkpoint. So those processes need to be thought of. How am I going to do this? Who am I going to choose to do this? And what records are we going to keep? And you're going to need to keep those records in a safe place should you need to access them later.
Very good, Mark. I appreciate that. So here, I'm going to go on this to step two, who comes back to work. But maybe the segue here, Mark mentioned surveys. Sheryl, you did, I think, a couple different surveys while offices were closed, while people were maybe got furloughed. Always taking temperature checks, but also not just as a checking for social concern, but real legitimate planning for the return. Can you talk about what your approach was for surveying?
Yep. So the first survey I did was really kind of probably about a month after everything happened. And really it was just to kind of get a pulse on our employees to see how this was affecting them, not only, the remote working, but even how concerned they were, just in their personal life, right? Just really kind of getting a vibe and a pulse on how they were doing, and just so that they would know that we're here, we're thinking about them, we're listening, and see if there was anything we could do, to help them while they're out. It's funny because, well, maybe not funny, but I think many of us suffered this, but the number one thing that people were concerned with was the social isolation. And I know that definitely took some getting used to. And after that survey, I really saw, the value in that. And so I think I've done a couple more surveys since then. And really the next survey was, okay, I need to determine when we do get ready to open, who is wants to come back, who's willing to come back, who's high risk, and what's that going to look like. So it was really kind of like a third. A third of them were ready to come back, a third were high risk, and the other third just didn't want to come back at all for their own personal reasons. And so then the next step is to decide, okay, we're going to stagger the folks that are going to come in. And really when we started doing that, I was trying to get folks in the office so that there were maybe somebody from each department in that day so that they could still collaborate and get their jobs done. But again, as I said earlier, I kind of jumped the gun on that survey. I did it because I thought we were reopening, then it changed. It's changed again. So I won't do another survey until I have 100% certainty that we're going back into the office, and that way I'm not redoing work and getting the employees worked up. So.
Yeah, very good. Stuart, what would you add? Some of the things to think about for coming back, includes, Sheryl mentioned staggered schedules. Some of it includes telecommuting and virtual work. What additional things are you guiding clients on?
Yeah, so I think in all of this, information is critical. And to loop in something that Mark said, I think it's wise to kind of mention for all these points is whatever your practices are or whatever strategies you employ, you need to be consistent. So for smaller, medium-sized businesses, perhaps that's not front of mind. They're basically having to think through on a daily and weekly basis. But some planning is required. When we talk about who's coming back first, has your leadership sat down and really kind of established, okay, what are our business critical needs? It could be different if you're an office environment versus industrial versus retail versus restaurant. That looks different, but you have to establish what's mission critical, and to again use the word that any HR practitioner mentions 1,000 times a day: be consistent. Are you making your decisions on business needs, making sure that your decisions are transparent, and making sure there is no whiff of potential liability to the company? Unfortunately, even in the midst of our crisis, we still have those things, those pesky things like employment laws and wage and hour laws that are still there, and we still have to be concerned as businesses. Is there a risk of potential discrimination? Are we treating certain folks differently? Are we applying a bias? Are we doing things inconsistently? So again, being consistent, I think, is appropriate as far as identifying return to work, and information is critical, and just really knowing what your people expect in return to work. How does that look like to them? That's also important to remember.
Hey, Stuart, go deeper on the consistency, because I think everyone at face value understands, hey, it's important to manage your employees consistently. If for no other reason, employees want to have a sense of fairness, right, in having a good, safe feeling workplace. But there's very real liability, right, that comes with inconsistent application of some of these practices. Talk about what some of that risk is if you don't implement these policies consistently.
Yeah, so again, you talk a lot. If anyone who's running a business is familiar with HR practices, especially when we talk about stuff, not that harassment's germane here, but it's the aspect of it's the perception, not the reality. So what is the perception to your employees? Do they feel like they're being forced to return to work when they don't feel like they're emotionally or physically ready? And how are you again, going back to a strategy, how are you employing that? Are you looking at groups of people and their job functions? Are you looking at other needs, whether or not maybe someone has worked successfully as a telecommuting employee? Those could factor in. So again, I always go back to what I'm hearing from clients and our internal folks, and that's kind of the nuts and bolts. I need to bring these people back. Some are comfortable, some are not. But as an employer, I have to look at the mission critical needs and really apply them fairly across all folks. Again, flexibility is required, because what you want, need, and expect as an employer may not exactly jive with what an employee wants, needs, or expects in return to work.
Yeah. Hey, Mark, go ahead, Sheryl.
I was just going to add, the other day, we're actually, as an organization, looking at, shrinking our footprint in the office. So we're really going through a process of assessing, hey, what employees can work from home, where can we save money on real estate, and kind of continue what we've been doing through this entire time. And I realized performance management is going to matter more now than ever, because we are going to have roles where, yes, we have some payroll processors who maybe their performance isn't great and they're not going to be able to work from home, but then we have rock stars that can. And those employees that are not allowed to work from home may get upset. And so we've really got to have our ducks in a row when it comes to managing their performance, to be able to document and show the reason we are treating one differently than the other, where one has to be in the office and one can work from home. So just something I've been thinking about.
Yeah, very good. Hey, Mark, I'm going to ask you a question here that kind of, I think, end caps when to come back to work, but also kind of tease up the next topic. So I'm going to go ahead and screen. But it's just, there are when and who comes back to work. There's real ADA, FLSA implications here, right? What are quote unquote reasonable accommodations for bringing people back, and I think segues into maintaining health in a safe workplace. Can you kind of talk to specifically ADA, FLSA considerations?
Certainly, and some of that goes back to what was said just a few minutes ago about communicating with your employees, being transparent, being upfront with them, because there is a ton of stress in the workplace right now. And those employees that are coming back are obviously very concerned. So how do we maintain this workplace? It's going to start with planning. And not only planning for, hey, can I even reopen? Do I have the materials I need? Do I have my supply chain in place? All that stuff. Sure, you need to look at that. Communicating with employees. What am I going to do? How am I going to do it? What do I have available to me? If you're going to require masks, make sure that you have masks available, obviously, and communicating that. Here's our requirements, having plans in place. So ADA stuff. There's a lot of things that you need to be aware of. Stuart touched on this, those pesky HR laws. You have to maintain confidentiality. You can't ask about disability. You can't ask about that stuff. But you need to get to, okay, let's say someone has a concern. I don't want to come back to work. Well, why not? Well, okay, what's your concern? Listen to that employee and say, here's how we're going to mitigate that factor. And it may come to the point where it's like, you can't assuage all their issues, all their concerns. Okay, so Sheryl talks about it being flexible performance management. We've got a great performer here. We've been accommodating this. Goes back to my example of the person in another state who can't get out of that state because travel's been restricted, as an example, or another country for that matter. Okay, we can continue to accommodate this. How can we do this? Da 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 da. So work with that employee. Be flexible. Be transparent. Again, you have to, and if it comes down to it, you may need to enter into that interactive process. What does that mean? Can I reasonably accommodate this person's concerns? Again, can I continue to let them work at home? Or can we change some of the ways we do things? Can we stagger our shifts? Can we stagger our desks? Can we have every other cubicle occupied? Sheryl touched on that, managing the footprint of the office. Break and lunch schedules. Can we stagger those? Typically you can. Can we limit the number of people in a conference room? Can we limit the number of people in an office? For instance, I was just talking to a client the other day. They have said, if you have visitors, you can't have them in your office face-to-face 2 feet away. You're going to have that conversation in a more public area, and you're going to talk about business. People walking in, they're going to need to go through the same temperature checks potentially. Maybe the health questionnaire. That checklist, let's say that you see at every hospital. Are you experiencing XXX, shortness of breath, fever, all this stuff within the last 2-3 days? No shaking of hands. That's a common business practice, especially in a professional setting. What's the first thing you do? Hi, I'm Mark. No, you can't do that anymore because of COVID-19. So how are you going to handle that and make that still be business friendly to your customers, to your vendors, to whoever's going to walk through the door? There's another thing, online meetings, eliminating the group gatherings or taking those group gatherings outside if the weather's nice. Right now in Seattle, not a good idea because it's pouring down rain as I'm looking out my window. However, on a nice day, can we gather in the parking lot for a quick team meeting? Sure, why not? If you can do that, great, wonderful, fantastic. So there's things to think about. Confidentiality is going to be key. Stuart touched on it, consistency, consistency, consistency. If you're going to apply it, you have to apply it consistently across all groups. So you have to be constantly aware, am I potentially discriminating against a group of employees, whether it be your customer service reps, whether it be your warehouse workers, whether it be your attorneys, whether it be your nurse, whatever the case may be, you have to be careful. Am I discriminating against someone who's in a different age group over 65. You can't ask them if they've got a disability. And as an example, state of Washington has added protections for those individuals over 65 who are still in the workforce. So there's a ton of stuff to think about. And that's going to start with training your managers on what to look for, how to interact with your employees, and to be open to listening and working through those concerns of your employees.
Hey, Sheryl, can you talk specifically what you did? I mean, you rolled out a pretty comprehensive and I'd say evolving health plan, right, to keep the workplace safe and employees healthy.
Yes, and so and also back to the surveys, one of the biggest concerns employees had are the employees that were kind of on the fence about coming back. They really wanted to know, okay, if I come back, what is that going to look like? And so it was very important for me to come up with a plan and to communicate that to employees so they knew exactly what it was going to be like when they got back. You know, are we going to be stocked up on hand sanitizer? Do we have wipes? Do we have cleaning supplies? Are we going to have extra cleaning? You know, what are we doing to ensure that if they're going to be coming back into the office, that they're going to be safe? So what I did is I came up with a consistent plan across all offices to make sure that we at least had that bare minimum base. And then of course, if the local sites wanted to go above and beyond or do something extra, they have that autonomy to do so, but just to make sure that we're all consistent.
And Stuart, maybe bring it home. Mark just talked about training, right? So whatever your policies are doesn't do any good if nobody knows what they are, right? Or if it was just, you can't send a single blast email and say, there, wipe my hands of it. I've just, forgive the pun, I've just sent out our health policy, right? What are some best practices around training, but not just training managers, maybe even separate from rank and file?
Yeah, that's a good point, Mike. And I mean, we all kind of hear these common sense ideas or suggestions for being safe in a health risk environment. But as an employer, you want to make sure that you are providing the appropriate procedures and policies. When I was coming through the ranks in HR throughout my career, had a couple of mentors, and they both impressed upon me regarding policies, procedures, and handbooks. You have print versus practice. So what that means is what you're doing in the workplace aligned to what you have in print? Otherwise, what you have in print is worthless. So when we're talking about training, make sure it models what you actually want to accomplish physically in maintaining a healthy and safe workplace. Otherwise, you're not going to get engagement. You spoke about, separate training for managers. I think that's appropriate. We always hear these buzzwords in business, buy-in, engagement, etc. When we're talking about something like this, even though we have a very serious point to make about health and safety, it sometimes falls on deaf ears. So it's really up to your all levels of management to really buy into, here's why this is important. Here's the documentation. Here are the steps we want to maintain based on the good resources we have, federal, state, and local. And here's what we need to convey to the employees. And then you get into, okay, how to distribute that. Are we talking pieces of paper? Are we talking webinars? Are we talking what do we need to do to prepare people before they walk in the door? Or do we do the training physically in person? At a safe distance, of course. All those things kind of factor into not only are you providing training, but how does that training look? How is it going to be distributed? And then how can you follow up and make sure that your procedures are being followed?
Awesome. Thanks, Stuart. So I think all three topics so far, right? When can you reopen? Who comes back first and how? Creating a safe environment. I'm assuming everybody on the call here is it, maybe different stages of their implementation or development of these strategies, but kind of at the forefront of thought, right? Something that I think is maybe not so obvious, but maybe more important, I think as we go to step 4 here, is how do we handle hiring and onboarding in specifically reentry, right? And Mark, I think I'm gonna go to you first because Sheryl even, talked about having furloughs, right? So if there's layoffs, there's furloughs. This might not be as simple as, hey, welcome back everybody, and then, but oh, by the way, you have to take your job just changed because now you're doing the work that John Doe used to do. There could be downstream unforeseen ramifications around salary, in fairness and consistency. Kind of talk us through that whole rubric, if you will.
Sure. Pay equity is going to be important. If you change somebody's job, you have to take a look at that. And temporarily, some people are willing to take on a few extra things, but if this is going to go on for a couple, 3, 4, 5, 6, 8 months, they're going to say, wait a minute here. I'm doing 2 jobs now as opposed to 1. I've got John, I've got Jax plus my own now, so now I'm doing 3 jobs. The other thing to take a look at is FLSA types of duties. If the person was an exempt employee, typically meaning salary, paid on a salary basis, they have their job, you get paid this X amount per week. Now, if those duties have changed to more clerical, to more routine types of things that aren't necessarily managing the business, managing people, things like that, suddenly they may not be eligible as an exempt employee. So you may need to take a look at changing their status to an hourly or non-exempt employee. It means that they are now eligible for overtime. So there is that issue. Bringing people back from furlough, bringing people back from layoffs, whatever the case may be, you're going to probably need to update your I-9s and your W-4s. So do you need to actually have brand new I-9s? No, not necessarily. You may need to re-verify. However, you will never need to re-verify, or you should never have to re-verify List B types of documents. You may need to say, okay, let's take a look at it. Let's make sure that if we need to re-verify anything, yep, you're rehired, recertified, blah, 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 whatever you need to do there. There's some guidance out there from DHS on that. W-4s, we have a new W-4 out there. Sheryl, maybe you can add a little bit more to this. So those are things to consider. Pay, job duties. Is this person still an exempt? Is this person non-exempt? Has the non-exempt person, non-exempt is always the fallback because it's more advantageous to the employee. So we've had clients in the past where everybody on staff from the president on down has been non-exempt. Now, obviously, a lot of your exempt level employees work more than 40 hours in a week. Okay, if you can afford it, great, wonderful, fantastic. This client had a ton of people working a ton of overtime, and they were making some pretty astronomical sums of money. Yippee for them. They did change that, which then became an issue. However, it's something to actually, you really do need to pay attention to, because you don't want to run afoul of a compensation audit from your wage and hour division, come in and say, well, gee, Mike used to do this, now he's doing all this other stuff. He's eligible now for overtime, which could mean back pay, overtime, back pay. It can get quite expensive very quickly.
Very good. Hey, Sheryl, maybe again, I love you bringing the real life stories. How did you do it? What were some of the issues you faced as you brought people back? Now, as an essential business, we never closed the doors, but we did have people work from home, slowly bring them to offices, bringing back furloughed employees. Talk us through that.
So some of the issues we've had, so we had some furloughed employees, and our CEO from the beginning said, what's going to be the new normal? I mean, coming into this new phase of how we're doing business, we're really going to all have to kind of jump in and work where we're needed, right? So as we thought about bringing back some of the furloughed employees, some of them didn't necessarily come back into the exact same job that they were doing before. And in fact, we had one employee come back and he asked to go back on furlough because he doesn't want to do what the job that we have available for him, so that's not an option. So, really just thinking through exactly this, if they come back and you don't have a role that they're kind of excited about doing, does that mean they can go back on furlough? Well, no, that means they're really kind of refusing work, right? And so in this case, we want to make sure and, notify unemployment and things like that. And then just in terms of onboarding and recruiting, it's been a challenge this entire time. Of course, the recruiting, there's been lots of remote recruiting, but then onboarding and getting that person going day one, it's really a lot of coordination with IT and with our onboarding team to make sure, because like I said, we have 8 offices, they're all in different phases right now. So really, we just kind of have to pay close attention and make sure we're either handling them remotely or maybe they're coming in. I even have one location where I have my template email, so-and-so will meet you at 9 a.m. Here's the code to get in, because everything is just so different now because not everyone's in the office.
Right, right. How about just really practical steps around, exposure risk planning in social distancing in an office with, cubes versus conference rooms? How did you work through that?
Yeah, I think most people are very aware of this thing. I mean, even just being out shopping. I mean, people are really cognizant of being respectful of others and keeping their distance. Of course, I went through and I've got masks and I've got hand sanitizer. And again, we talked about, being strategic about the way we're having those folks in the office to make sure that we are, it's every other cubicle, and we're cleaning more in the kitchens, or we're not serving food and doing things like that we would have done before. But really, people, I mean, we've been doing this for, a couple months now, and I think people are very aware, and they really want to be cognizant of and respect others while they're in the workplace. Now, again, we are putting restrictions on how many people can be in conference rooms, and after meetings, we're wiping everything down, just doing all those things to really try to take the extra step to make sure we're going above and beyond.
Yeah, very good. Hey, I want to come back to you on another question around recruiting, but I want to ask Stuart, there's a stat we put in the ebook that, 73% of working professionals are currently suffering from burnout, compared to just 61%. I shouldn't say just, that's a big number, but 73% claiming burnout today versus 61% in mid-February. So, this past 3 months wasn't a vacation for a lot of folks, right? So we're saying we're all in the same storm, not in the same boat. A lot of people had extra duties here. How should employers be thinking? How should small business owners, mid-sized business owners, be thinking about handling burnout for bringing employees back?
Yeah, so that's a fair question, and Mark had it right. I mean, you're returning to a workplace that already has an incredible amount of stress. So you hear the old saw, where there is crisis comes opportunity. I'm encouraging clients to kind of think in that perspective. Those folks who are being asked to do more, maybe broaden their activity or job responsibilities, use that for performance management. How are those folks succeeding? And if so, do you have a plan for either promotion or expanding your jobs? I think everyone kind of understands that throughout this crisis, we have been and will be asked to perform duties that are not our normal cup of tea. Sheryl mentioned someone who actually, wanted to go back on furlough rather than accept a position that was not to their liking. Unfortunately, as stakeholders, decision makers, you kind of have to apply that very I don't want to say harsh, but you have to be very calculating in what are you expecting versus what your employees are expecting. If you are expanding job responsibilities, could mean one of two things. Either there's going to be some resumption of normalcy once other people return, or this may be an opportunity to say, really that role needs to be written anyway. Have we updated our job descriptions? Are those policies in our handbook the way we want? Do we have a full-time HR person who can address that? Again, speaking, I think Mark mentioned pay equity. That's something else to consider too. As people have more responsibilities, is the compensation in line? Of course, we're all tightening our belts financially throughout this, but we have to think about getting out on the other side, and what is that going to mean to employees? So again, to kind of spin this in terms of opportunity, this could be a real, if not a wake-up call, maybe a real way to approach your workplaces. Are the jobs you have, are the jobs you're filling sufficient to handle everything that's needed, or perhaps do we need to address that and maybe again show your employees formally, hey, we're reevaluating your job in light of what you've done. This could mean something down the road, or we're providing more of a development track for employees who choose to remain with the company.
All right, awesome. Say, I'm looking at the clock. We got a couple of questions to get through, but there's one big topic in Sheryl, I wonder if you could talk about how we're addressing maybe some of the new world challenges that you're finding around recruiting. So how has recruiting changed, post return to work?
I depend heavily on my director of recruiting for that piece of it. I'm not involved a ton, but I do know. I mean, for us, one of our things that our CEO said from the beginning was, hey, yeah, these are really tough times and we've had to cut back, but we're going to have great opportunity because there's other companies that aren't able to keep their employees working. We even had other companies reach out to us and say, hey, I've got this rock star payroll processor, but we're having to do a layoff. Do you have a place for her? And so we're really kind of seizing the moment and taking the opportunity to pick up some rock stars that can really kind of come in and take off and get going right away, that know our industry. So that's just one of the things that we've done. And then, of course, in terms of interviewing and things like that, I mean, a lot of that stuff is being done remotely because A, travel is very limited, and B, some people may not feel comfortable with even traveling now, even though you can. So those are some of the things that we have going on in recruiting.
Yeah, I've personally spoken to 3 or 4 business owners in the last 10 days who, it's hard to be too celebratory at a time like this when, there is a lot of legitimate hardship. Some companies, including Assure, like you mentioned, had layoffs, had furloughs, but at the same time are picking up some amazing talent because this has been a really a disruptive event for so many customers, for so many companies that I think is a champion for small businesses. I would for sure say Assure would be advocating and guiding the position. Hey, no matter how tough times are, you should always be on the lookout for talent, right? Because this has been a trigger event that you might not find some people with this level of experience available to add to your team, and maybe
Exactly.
ever. Yeah. So as tough as it is and empathetic as you need to be to your current staff, you don't miss this opportunity, right? Okay,
Exactly.
let's talk about a tough topic. Refusing to work, and there's lots of reasons to refuse, right? There's plenty of employees talking to small business owners that they have employees legitimately think it's too soon. They think they're concerned for their safety. If not their safety, they're concerned for their elderly parents who they don't want to stop seeing. And so there's lots of reasons why people don't want to come back, and when they do come back, there's lots of legitimate reasons why they need time off and request leave. So I think I'm going to try to kind of put this in 2 buckets, and Sheryl, I'll kind of have you start the front end of this. How do you handle, and because you got some real life experiences here, first, how do we handle those who refuse to return to work, don't want to come back to work, but then kind of let Stuart and Mark talk about a little more of the a little more wonky HR stuff, right? Because there's some laws that we got to be following, newly passed laws when it comes to this topic. So, Sheryl, you want to kick us off and just, what are some of the best practices? How have you been handling those employees who don't want to come back?
For me, I have not put a stake in the ground that says you have to come back to work, and I really don't think anybody really could this year unless it's necessary that you be in the office. I mean, yes, you could, but like Stuart said earlier, it's not what you can do, it's you should do the right thing, right? And so for me this year, just in my mindset, I'm thinking, you know what, I'm gonna have to be flexible. And for me, I've thought all the way through the end of the year, you know, until the authorities are saying this thing is over and it's 100% safe for everyone to come back into the office, I feel like we have to walk a very thin line to make sure that we're not forcing employees to come back. Now, at that point, when we do make that turn and employees are able to come back into the office and should feel comfortable doing so, then that really becomes, you know, there's going to be those employees that don't want to come back, and then you've really got to look at, okay, like Mark said earlier, what are your fears? You know, if they're really fears that we can't, like, you know, one employee said, well, you know, we have to share an office. We're in a, you know, a building with other employers, and I want special air filters to filter the air. Well, you know, those are things that we really can't control. So we really have to look at, okay, what can we control? What can't we control? And then assess, okay, is this an accommodation with ADA? Is this something we have to do with that? And if it's not, then it's really going to become a performance issue. So again, I think that we're quite a ways away from that, maybe 6 months or so. But I am starting to go ahead and think about those things because we will get there eventually.
Yeah, right. And then it's going to get really hard at some point because we all know there's never going to be such a thing as 100% safety, but
Right.
we're not all going to agree as human beings on what that level of tolerance and where that line of acceptability is, right? So
Right.
probably a webinar to have in Q4.
Yes.
that time. Stuart, Mark, I don't care who jumps in first. Let's talk about some of the legalities here, right? You know, FFCRA, you know, new sweeping legislation that kind of dictates some of this stuff. Also, some good old-fashioned ADA, FLSA regulations that need to guide our behavior. Talk us through the compliance landscape here.
Well, the overall thing to remember is that OSHA grants workers the right to refuse to work if they believe there is a threat within the workplace that could cause immediate or imminent harm. The employer has a duty to provide a safe workplace. Now, communication, we've talked about throughout this webinar already. Communicate with your employees. Here's what we're doing. Here's how we're going to do that. So alleviating those issues up front is better than trying to tackle them later, because you can do it as a group, you can do it whatever the case may be. So there's the OSHA regs. The other thing is to remember is the National Labor Relations Act, the NLRA, also has some provisions that say, hey, you can't stop employees from talking about working conditions. So you have to be careful about that. Employees are going to talk the whole time. We're going to talk about this, we're going to talk about this. Yeah, you know, I have to do this, I have to do this, whatever the case may be. So there's some things there that you can do up front. And one of the things that I'm really going to encourage our attendees to do is, and we haven't talked about it yet, is what happens if there's an exposure in the workplace. So you have to have a protocol in place for that, and it has to be done immediately. Isolate the employee. How are we going to do this? We have to notify the health department, all that stuff. That's something that's a very critical key element, because I would guess you're going to get that question sometime in the next 3, 4, 5 months. What are you gonna do if somebody comes in and there's an exposure? That's a very critical piece. What can you do if somebody says, no, I don't want to come in because I'm caring for someone in my household who's in a protected class? Okay, are you actually caring for them, or are you just living with them? Explore that a little bit. Do you want to come right out and say that directly like that? No, tell me more about what that issue is. So you're going to get some background information. Now, what you have to be careful of is, could they disclose a disability? You have to be careful about that. You can't directly ask them, oh, are you in a protected class? Do you have an underlying health condition? Talked about that earlier. So be willing to engage with your employees and say, what are your concerns? And then have a plan in place to mitigate those concerns.
Very good. Well, Stuart, what would you add?
Yeah, so Mark's raised some good points, and it gets back to those first principles we've been alluding to, and that is, even in the midst of this crisis, you still have those intersecting bits that affect the workplace. So, definitely use your resources from CDC. For those more office-related environments, you may not have much experience with OSHA, Occupational Safety and Health Administration, but they put out a great publication. If you look up OSHA 3990, that is preparing the workplace for COVID. That's a good kind of ready resource, and that's just one of several great resources out there. But in dealing with the thorny issue of people returning to work, again, back to first principles. Do you offer paid time off? Are you a subject employer under the Coronavirus Response Act? Are you offering paid sick leave? What are your policies about once leave is used up? Do you also have the intersection of FMLA? Are you covered under that? And do you have folks eligible for that? So those are also considerations when we're talking about people returning to work or maybe sensitive to returning to work. What is the landscape for them? What kind of coverage they have? When you talk about federal law in general, you can make the blanket statement that you're not legally required to offer time off, of course, unless it's a state requirement, if someone is scared to return to work. So meaning if someone has used up all available paid time off, be it crisis related or company related, and they're not ready or willing to return to work. What is your policy on unpaid time off? How does that look? Again, reinforcing Sheryl's point, it is a very fine line. You don't want to lose good quality people, but you have to be prepared for that eventuality when someone's ideas or thoughts about not returning to work becomes an issue that is subject to a disciplinary action.
Yeah, very good. So I'm conscious of time. We've got a few minutes left. I'm going to go, before I go to step 6 to wrap up. I want to guide people to prior webinars we've had specifically this topic. Mark and others have given a lot of guidance around the FFCRA, Families First Coronavirus Response Act, where there is very specific guidance on leave requests for what the qualifications are, what employers qualify, what employees qualify, what are the qualifying events, and what some of your obligations are. Also, tons of documentation of this on the website. So, last step: how do you plan for financial health? We could go deep. Again, there's a lot of webinar content on our website around PPP. Overwhelmingly, that's where the big dollars lie. If you haven't applied, please apply. If you haven't explored and attended one of our webinars or explored anywhere else for how to maximize your PPP forgiveness, please do so. There's a lot of nuance in how when you take the money, how you spend the money, how you manage your employees is really critical to understanding that how to maximize your forgiveness. If you wait to apply for the forgiveness at the end of the term, now 24 weeks, not 8, it's too late because the money will have already spent, and either it was spent on qualifying items or not. So do your homework at a time. But maybe I don't care who wants to jump in. Just a quick note on some things that are less obvious, and I think specifically around the tax deferrals and tax credits. Maybe Mark, can you speak to that, or Sheryl, do it. I don't care who. Specifically, some of the tax credits around CARES and FFCRA.
Well, just really quick, I think that it's essential that you have a payroll provider that's really on top of these laws and how this stuff works, because there is so much that goes into it that it's really important to have a partner that knows what's going on. I know there's no way I could do it on my own. And then another thing too is just transparency with your employees. There's so many companies that had to do furloughs, had to do pay cuts, and it's a tough conversation to have with your employees. But I think as long as you keep the lines of communication open and really try to be transparent on truthfully what's happening and truthfully what the future looks like for them in terms of their own personal financial health, I think that is very important.
You know what? I love that you went there and made it about the employees' financial health, not just the companies. That's awesome. Mark or Stuart, anything for closing remarks on this topic?
Document, document, document. Why does somebody not come back to work? Why does somebody need leave? Document it, document it, document it. There are some, as Mike, you alluded to, there's some great resources. Prior webinars, we talked about how to document someone who needs to go on leave or emergency paid sick leave, all that stuff. And how to say, okay, once it comes to that loan forgiveness and all, and the tax credits and all that, that you have that in place so you can say, here it is, and away you go.
Stuart?
Yeah, absolutely. Mark made some great points. You know, adjust to the new realities. We've talked about a lot of this. How is this affecting your recruiting and hiring? You're probably having to do a lot of stuff distance, remotely, electronically, that you used to do in person. So how does that look, and how can you scale that if you need to? How can you onboard people quickly and effectively, especially in different offices? If you have more people needing to work remotely, how does that change what's called your nexus of control? Are there tax implications for that? Make sure you have people on your side to kind of help you with those decisions. Having a decent payroll provider to run those reports when you need them on a fly. Having an HR person on your side to kind of help you manage this glut of information. And then finally, you know, and we've been talking about transparency for employees. I love quotes, and there's a quote that someone did recently, not recently, but a print newspaper person. The two words information and communication are often used interchangeably, but they signify quite different things. Information is giving out, communication is getting through. So definitely the communication is getting through to you, the employer and decision maker. Just make sure in everything you do, you're getting through to your employees.
Yeah, very good. And guys, if you had questions, we will review them. We'll do our best to get back to you on them. I would say stay tuned. We'll continue our webinar series specifically on topics that involve this COVID pandemic. And our objective is to help small businesses survive this pandemic in this kind of a once in a lifetime event, so that we can all thrive and grow out the other end. If you hop on our site, assuresoftware.com/COVID-19, tons of resources, including a list of links to every single state and most all the major city, municipalities, all of their COVID sites, so you can find your local laws and regulations and things that you need to follow. Also, lots of offers, free HR services for folks who need it. This is a complex topic. Incredible offers for payroll, where we can provide included in our services PPP reports to help you all the submissions of those forms in forgiveness applications, and we just want to help you grow. Our objective is we don't see payroll and HR as just solely for compliance and transactions. Those are important, but ultimately it's about how do you attract people that have the kind of talent and get behind your vision to grow your business. So with that, we look forward to seeing you in the next webinar, and thanks for joining us today.
Thank you.
Thanks, everybody.